in this video, we'll shortly discuss what is trigeminal neuralgia and what is the management. So first of all, trigeminal neuralgia, it has a lot of names. So first of all, you need to remember the name Fothergill's disease, or you can also remember the name tick Dolurex. Now, coming on to the trigeminal neuralgia, what basically happens is that some of the arteries or the vessels, they compress the rootlets of the trigeminal nerve, due to which there occurs compression of the trigeminal nerve, and hence it leads to neuralgic pain or facial pain. Now, one thing to remember is that the difference between trigeminal neuralgia and Bell's palsy is that in trigeminal neuralgia you have certain trigger points. That is, if you for example, there are like vermilion border of the lips, or we can say cheek, also the tongue, middle part of the midline of the tongue. So such parts are the trigger points of trigeminal neuralgia, whereas in Bell's palsy there are no such trigger points. Also, so if there are trigger points, so the person might experience pain when they are shaving, or while they are touching or washing their face, or even brushing their teeth. Also, if the cold breeze comes and comes in touch with the trigger points, it can also elicit pain. Then also, in Bell's palsy also, you need to remember that cold was also a predisposing factor. Okay, then coming on to why is it called tick dolorex? Because it causes the twitching of the facial muscles. All right. So this is basically a disease which shows a lot of remissions in early states, and then it as it advances, it becomes less frequent. So basically, now we'll come on to the management. So in management, you just need to remember a simple acronym. As in maths, we had CPCT. So it meant congruent parts of congruent triangles. Just instead of T, replace it with an L. So you have to remember CPCL. Okay, all right. So by C, what I mean is carbamazepine / phenytoin gabapentin. Now, initially, they're given in a dosage of 100 to 200 milligrams. Initially, 1 to 2 times a day, 1 to 2 times a day, and then it is 200 to 500 milligram. The dosage is increased. Now, by P, remember phenytoin. Okay. Now, the phenytoin is initially, it is given average dose is basically 300 milligrams, but initially you will give it 150 and then bring it to 500 milligrams. Okay. Then by C, we have clonazepam. Now, clonazepam is given in the dosage of 0.5 to 2 milligrams daily, 8 hourly. All right. So, basically 3 times a day. So, fourth, instead of T, remember L, lamotrigine. I hope it's Trigen. So this is given in the dosage of 400 milligrams. Now all these drugs have to be given for 2 to 4 weeks. All right. So this is the treatment of trigeminal neuralgia.